Hello everybody, I'm Dr. Arpitha Komanapalli and I'm glad you're watching this video. In this video, I'll be talking about iron and its deficiency. Iron deficiency is the most common nutritional deficiency according to the CDC or the Centers for Disease Control, with almost 10% of women being considered iron deficient. Meanwhile, it is estimated that up to 80% of the world's population may be deficient in iron and 30% may have iron deficiency anemia. Iron is an essential nutrient that helps us perform many functions throughout our body every single day. One of the most important functions is it helps to transport oxygen throughout the blood. It's clear that many, if not most, people do not eat enough iron-rich foods on a regular basis. So what is iron deficiency? An iron deficiency is most commonly linked to the development of anemia, which is a condition when there is lack of healthy red blood cells being produced in the body. Iron helps metabolize proteins and also play a role in the production of hemoglobin and red blood cells, helping prevent anemia from forming. So iron is needed to produce hemoglobin. This is a type of protein found in your red blood cells that has a role of carrying oxygen from your lungs and transporting it throughout your body to your cells. So an iron deficiency can mean that you are not able to produce enough oxygen carrying red blood cells. Therefore, your body struggles to transport oxygen to important organs like brain, tissues, muscles and cells, leaving you feel exhausted and weak. So aside from preventing anemia, iron is a nutrient needed to maintain general well-being, energy and healthy metabolism because it supports overall cellular health and is involved in many enzyme functions. Iron plays an important role in enzyme reactions that helps our bodies to digest foods and absorb nutrients. So these reactions also balance hormone levels and support brain, heart, skin, hair, nail and metabolic health. So most of the 3 to 4 grams of elemental iron present within our body is in the form of hemoglobin. The remaining iron is stored in liver, spleen, bone marrow or is located in our muscles like myoglobin. Here are the symptoms for an iron deficiency. It can lead to following conditions like anemia, chronic fatigue or low energy, pale skin or yellowing of the skin, shortness of breath, abnormal heartbeats, signs of a hormone imbalance, trouble exercising, muscle weakness, changes in appetite, trouble getting good sleep, changes in weight, cough, trouble concentrating, learning, remembering things, sores on your mouth or tongue, mood changes, dizziness, strange cravings to eat items that are not food like dirt, ice or clay, a tingling or crawling feeling in the legs, tongue soreness or swelling, cold hands and feet, fast or irregular heartbeat, brittle nails, headaches, a poor concentration, weakened immune system and also leaky gut or IBS. So people at great risk for iron deficiency anemia include especially women of childbearing age, especially women with heavy menstrual bleeding, pregnant women, people with poor diets, people who do not donate blood frequently, infants and children, especially those born prematurely or experiencing a growth spurt, cancer patients, patients with or people with heart failure, people who have gastrointestinal disorders or have gastrointestinal surgery. Also vegetarians who don't replace meat with another iron-rich food. Consuming iron-rich foods is very important for premenopausal women who have higher iron needs than men because of their monthly blood losses. If you are low in iron, it is also critical to get plenty of vitamin C in your diet, since it is vitamin C increases iron absorption. So the recommended dietary allowance for iron is 8 milligrams per day for men and older women, while premenopausal women need 18 milligrams per day. And the RDA for vegetarians are 1.8 times higher than meat eaters due to the fact that meat's iron is more available or bioavailable than the plant-based foods. Also, meat, poultry, seafood increase the absorption of this non-heme iron. The risk factors of iron deficiency include, most common reasons are if you follow a strict vegetarian or a vegan diet which does not include any animal source of protein that are naturally high in iron, or if you exercise a lot, which sometimes can damage red blood cells, if you are pregnant or breastfeeding, if you have ever had kidney failure, if you're undergoing or have undergone dialysis treatment. This can remove iron from the body. If you had ulcers in the past, or if you have any known GI or gastrointestinal disorders that can limit your ability to absorb nutrients like celiac disease, Crohn's, or ulcerative colitis. If you take a high amount of antacids, because these contain calcium which will prevent iron absorption. Also, if you have recently had a surgery or lost blood for any reason. So the amount of iron that someone needs daily in order to prevent iron deficiency varies a lot depending on their age and gender. Women need more iron than men because they lose a certain amount of iron during their normal menstrual cycle each month. Starting at around time of adolescence, when a woman begins having their cycle, her daily need of iron increases, but then the level decreases once again as the woman reaches menopause. So women who are between the ages of 19 to 50 need to get the most iron of any group, that is about 18 milligrams of iron each day. However, men of the same age can get away with having much less and will be still at lower risk of having an iron deficiency. Men need just about 8 milligrams of iron daily. So iron deficiency is usually pretty easy to identify with a simple blood test called the serum ferritin test. In fact, some people find out that they may have an iron deficiency when they attempt to donate blood at a blood donation center, and the required screening test reveals that their iron levels are low. So it is recommended you get your blood checked on a regular basis to see if you need to increase your iron intake, especially if you are pregnant or a vegetarian or having a digestive disorder. Toddlers need more iron than children because iron supports the process of growth and cognitive development. It can be hard for young children to get enough iron from their diet alone, especially if they are picky eaters. So having a blood test done during a toddler's yearly checkup can identify an iron deficiency before it becomes a bigger problem. Breast milk is believed to contain highly bioavailable iron, but in the amounts that are not sufficient to meet the needs of infants older than 4 to 6 months. It's best that babies begin to eat solid foods that are naturally rich in bioavailable iron, or to eat some iron fortified foods or formula that they are able to do. So women who are pregnant may need more iron than general population. So it is recommended that they take iron as a part of their prenatal vitamin complex. So when it comes to prevention of iron deficiency, when it comes to getting enough absorbable iron from food sources, there are several things to consider. As I mentioned before, animal foods contain a type of iron called heme iron, which is more absorbable than iron found in plant, that is called non-heme iron. So when you eat different foods together, they can interact to either boost the ability to absorb iron, or they can do the opposite to make it harder to absorb the iron present in the foods. So if you are a vegetarian or vegan, you'll want to be careful about getting enough iron, or may want to consider taking a supplement. So this is because the type of iron found in plant food is known to not be as absorbable as animal sources of iron. So iron from meat, poultry and fish, the heme iron is absorbed 2 or 3 times more than efficient than iron from plants. So the amount of iron absorbed in the body also depends on other types of foods eaten at the same time or at the same meal. Foods like meat or fish that contain animal source of iron enhance body's ability to absorb the type of iron present in plant foods. Iron can also be found in plant foods like spinach and beans. But when you eat these foods along with an animal source of iron, your body is able to use the iron better. Now, because foods containing vitamin C can also enhance this non-heme iron absorption, this is another great way for vegetarians and vegans to increase their iron stores. There are also substances found naturally in some foods and drinks that decrease the body's ability to absorb iron. So foods that contain chemical components like polyphenols, phytates or calcium make it harder for the body to absorb and store iron. These can be found in foods like tea, coffee, whole grains, legumes and dairy products. So when it comes to diet, it might seem complicated to pair the right foods together in order to absorb iron in the best way. But if you eat a varied diet overall that includes plenty of whole foods, you're unlikely to need more iron. So in general, try to eat a varied whole food based diet that includes good sources of iron like grass-fed meat products, organic free-range poultry, cage-free eggs, or organic dairy products like raw milk, plenty of different fruits and vegetables, beans, and occasional whole grains. Also, try to eat foods in combination that help your body to absorb iron better. For example, you can pair a food that is naturally high in vitamin C, like leafy grains or citrus fruits, with beans to make a better source of iron, since vitamin C helps your body absorb the non-heme iron. You can include some of these high vitamin C foods in your meals in order to increase the absorption. So here are the 12 best food sources of naturally occurring iron that can help you prevent iron deficiency. The highest percentage is found in the liver of animals, white beans, lentils, spinach, kidney beans, chickpeas, sardines, grass-fed beef, lamb, blackstrap molasses, pumpkin seeds. All these are very iron-rich foods. So when someone has too much iron in their blood, this can also create problems. Iron overload is the accumulation of excess iron in body's tissues and cause a disorder called hemochromatosis. This is unlikely to happen from eating food-rich food sources alone. Instead, hemochromatosis is usually caused by either genetic causes or from taking iron supplements in high amounts. So high doses of supplements of iron, which is more than 45 mg per day or more, can cause side effects like nausea, vomiting, cramps and constipation. But iron in moderate amounts is thought to be well tolerated and shouldn't cause many adverse reactions. So keep in mind that iron can interact with other nutrients including calcium. Some studies show that calcium might interfere with the absorption of iron, although this effect has been not proved so definitely. Still, experts suggest that people taking calcium and iron supplements should do so separately, spaced throughout the day, in order for both to be most beneficial. In people who have taken medication for Parkinson's disease, cancer, or heart disease, the medication may be malabsorbed when also taking iron supplements. So as a result, these people will want to speak with their physicians or doctors before taking any iron supplements on their own. I hope this information was helpful. Here is a scripture to meditate. My grace is sufficient for you, for my power is made perfect in weakness. 2 Corinthians 12:9. Thank you so much for watching, and don't forget to share this video with your family and friends. I'll see you again in my next video.